Welcome and good evening. This is Eunice with Florida Train Academy, and we're going to get started in about 10 seconds. Tonight's review will be caring for patients with diabetes. And I think I already see a few comments. So, hello, Julene. Hello, everybody. Hello, Bagoth. Hello, Anna. We'll get started shortly. All right, so question number one. What is the primary hormone responsible for regulating blood sugar levels? A, insulin, B, glucagon, C, epinephrine, or D, cortisol? Hello, Fatu. Whenever someone has diabetes, it's because they're having a problem regulating what? We'll reveal the answer in three, two, and Anna, you got it correct. Hello, Lachey. It is insulin. So, insulin is produced by the pancreas and helps to lower blood sugar levels by facilitating glucose intake into the cells. So they have an insulin production problem, which is why they will sometimes be prescribed subcutaneous insulin or insulin injections because the pancreas cannot excrete enough insulin to regulate their blood sugars. Question number two, everybody. What is the common method for monitoring blood glucose levels? Is it A, magnetic resonance imaging, B, electrocardiogram, C, glycated hemoglobin test, which is a HbA1c or a hemoglobin A1c, or D, glucose meter, blood glucose meter? What do you think the correct response is? And you all are so sweat. Hello. Hi, I missed you too. And Pisces says, good night, everyone. The answer is D. You are correct. So, a blood glucose meter is a portable electronic device used to measure the concentration of glucose in the blood. They are the primary method for self-monitoring of the blood glucose levels. The MRI and ECG are diagnostic tools used for other purposes. And yes, sometimes whenever we have a diabetic patient, you may hear the term hemoglobin A1c, but that measures the blood glucose levels over time. And what most of our patient care techs can do at the bedside is the finger stick or the blood glucose meter check. Number three, what is the importance of monitoring blood glucose levels regularly in diabetic patients? A, to prevent dehydration, B, to adjust medication and treatment plans, C, to promote weight loss, or D, to monitor cholesterol levels. I'm looking for some answers. Yes, Anna. Yes, Gautam. Yes, Vinat. The answer is B. So, you, as the CNA on the care team, it is so important for you to get those blood sugars right before their meals because, based upon the reading that you provide to the nurse, we're going to either change the dose of insulin, not give any insulin at all, or call the doctor if something's really wrong. So, whenever you're checking those blood glucose levels, it helps to monitor, it helps us in adjusting medication doses and treatment plans. Number four, in diabetic foot care, why is it essential to inspect the feet daily? A, to promote relaxation, B, to detect early signs of infection or injury, C, to improve circulation, or D, to enhance balance. Yes, yes, yes. So many correct answers. It is B. So let's say this is your patient and you notice this on the great toe. Stop. Don't perform any care. Notify the nurse immediately. Daily foot inspections help identify wounds, infections, and abnormalities early, thus preventing complications. Number five, what dietary recommendation is crucial for diabetic patients? Think about the type of diets they're on. Is it A, high sugar intake, B, low fiber intake, C, consistent carbohydrate intake throughout the day, or D, irregular meal times? This one's easy. All right, we're going to be revealing the answer in three, two, and yes, Crystal, you are correct. Rita, congratulations on passing your CNA exam. So, for this one, everybody, if you chose C, you have the right response. And so, your diabetics will usually be on like a 1,800 calorie ADA, American Diabetic Association diet. So, we have to, over the course of a day, make sure they're not getting too many carbohydrates at one time. So they may get 800 carbohydrates in the morning, 800 for lunch, and maybe a little bit less in the evenings. So the reason why consistent carbohydrate intake is important is because it helps to regulate and maintain stable blood glucose levels throughout the day. So great job if you chose C. 6. Which emergency condition is characterized by a state of unconsciousness resulting from severe hyperglycemia in diabetic patients? Is it A, diabetic coma, B, hypoglycemic coma, C, insulin shock, or D, hyperglycemic hyperosmolar state, HHS? This one's tricky. I see A, I see B, I see a lot of B's. And remember, the key word for number 6 was severe hyperglycemia. So it can't be B because B says hypoglycemia, which is the exact opposite. So the answer, if you chose A, great job. A diabetic coma is characterized by unconsciousness resulting from severe hyperglycemia in diabetic patients. So this is when their blood sugars are higher than normal. It typically occurs in individuals with type 2 diabetes and is associated with extremely high blood sugar levels, dehydration, and altered mental status. And in the very fine print, I remind you that hypoglycemic coma, which is option B, occurs due to severe hypoglycemia, not hyperglycemia. So it's the opposite. But in both states, they could become, they can have like a comatose state. But this one specifically said hyperglycemia. So the blood sugar levels were abnormally high for this one. Team number 7, which complication is associated with uncontrolled diabetes and can lead to vision impairment? A, osteoporosis, B, diabetic retinopathy, C, hypertension, or D, asthma? I'm looking. I think it's Salamowit. Crystal, great job. Diabetic retinopathy. So here's the explanation. Diabetic retinopathy is a complication of diabetes that affects the blood vessels in the retina, the light sensitive tissue at the back of the eye. Over time, high levels of blood sugar can damage these tiny blood vessels, leading to vision problems and even blindness if left untreated. So, this is why you'll hear us say that diabetes can cause blindness, because diabetes causes diabetic retinopathy. Number 8. Which should a nursing assistant do if a diabetic patient experiences hypoglycemia or low blood sugar? A, administer a large meal. B, provide a fast-acting carbohydrate source. C, notify the nurse. Or D, delay treatment. Oh, I see a lot of B's. Yes, Pisces. Yes, Crystal. It is C. You have to notify the nurse first before you decide to give them something by mouth, because what if they're unable to swallow because they're in a comatose state because of their sugar levels? So for this one, everybody, the answer is C. Hypoglycemia is a potentially dangerous condition characterized by low blood sugar levels. If left untreated, severe hypoglycemia can lead to unconsciousness, seizures, coma, and even death. Therefore, it is crucial for nursing assistants to notify the nurse promptly when a patient is experiencing hypoglycemia so that the appropriate interventions can be initiated to raise the blood glucose levels. And you were correct. Once your nurse tells you to get something that is high in sugar or carbohydrates, such as orange juice, you can get it, but you should never get it without the nurse telling you to do so. As a nurse, I could start an IV and give dextrose intravenously or give them sugar in the vein. All right, so number 9, why is it important to educate diabetic patients about their conditions? A, to increase dependency on healthcare providers. B, to empower patients to manage their condition effectively. C, to discourage self-monitoring. Or D, to create confusion. Yes, Vinette, I think you have it. Yes, yes, yes. It is B. So imagine me telling a patient that they're on uh, um, a sugar-reduced diet, that they can't have all the sweets, and you don't go back in there and reinforce what I said, and they're eating a Snicker bar. So we want to empower patients to manage their condition, and you do so by reinforcing what the nurse has taught that patient. So B is the correct answer for that one. Number 10, what role does physical activity play in diabetes management? A, increases blood sugar levels. B, causes weight gain. C, improves insulin sensitivity and helps control blood sugar levels. Or D, aggravates complications. Physical activity is good for your diabetic patients. Why is that? Anna, Craig, Rita, Pisces, you are correct. It is C. So yes, we want those patients up. Even if you're in your hospital, we need them up. Take them for a walk around the unit, because if they just lay there all day, they're not burning any calories. Their sugars are going to stay up. So regular physical activity helps to improve insulin sensitivity and aids in maintaining healthy blood sugar levels. That's also why when your patients are hospitalized, their sugars are all over the place, because they're not really moving. They're not burning any calories. So their sugars are higher usually when they're in hospitals due to stress and due to inactivity. All right, number 11, which of the following is a symptom of hypoglycemia or low blood sugar in diabetic patients? A, polyuria. B, confusion. C, hyperglycemia. Or D, flushing of the skin. Don't get tricked. The symptom of hypoglycemia cannot be hyperglycemia. So the answer for this one is not C. I'm seeing some answers. Yes, everybody, it is B. They can become really confused. So, confusion is a common symptom of hypoglycemia in diabetic patients. Hypoglycemia can lead to neurological symptoms such as confusion, dizziness, irritability, and even loss of consciousness. And A is polyuria or excessive urine. That's usually not associated with hypoglycemia. And also flushing of the skin. D is not typical of hypo or low blood sugars either, hypoglycemia. Number 12, which of the following symptoms is a characteristic of a diabetic emergency known as hypoglycemia? So this would be another symptom that we haven't discussed. Is it A, diaphoresis or excessive sweating? B, polyuria, excessive urination? C, hyperglycemia? Or D, hypertension or high blood pressure? I haven't seen a right answer yet. I see B's. It's not D. You're learning a new word, Anna and Salamawit. You are correct. Everyone is called diaphoresis. They start sweating profusely. So diaphoresis or excessive sweating is a common symptom of hypoglycemia, or when the blood sugar drops too slow. So that could be a warning. Your patient's like kind of confused and they're sweaty. Oh, get that nurse in the room, because more than likely their blood sugar is dropping. And if you haven't subscribed to our channel, this is my reminder. Subscribe. Make a commitment to Nurse Eunice. I get so many emails and comments from I call you all my babies for passing your CNA exams, and I love being part of the process and helping you get to your next level in your careers. So, number 13. Which food item is a good source of fiber and is recommended for diabetic patients? A, white bread, B, white rice, C, whole grains and legumes, or D, sugary cereals, which is what I had for dinner last night. Don't judge me. Yes, whole grains and legumes, everybody. Don't give them anything white or anything processed because that would be a simple carbohydrate and that is not good for them. It's going to be too easy to break down and turn into sugar. So your diabetics need whole grains. And again, it's rich in fiber and it helps to manage and maintain their blood glucose levels. You all are so smart. Number 14, which precaution should nursing assistants take when providing foot care to diabetic patients? A, use sharp instruments to remove calluses and corns. B, apply antiseptic solutions directly to open wounds. Ouch. C, avoid applying lotion or cream between the toes. Or D, perform foot massages vigorously to improve circulation. Yeah, I couldn't trick you all with this one. Gregory, do not perform a vigorous foot massage on a diabetic. You're going to cause a bruise. So, everybody, for this one, it is C. Great job. Applying lotion or cream between the toes should not be done. And you don't want to do that because the excessive accumulation of moisture can cause fungal infections. So, they do not get any lotion between the toes. And you all, very good job. No one chose using sharp instruments because it's not your role to remove calluses or corns. And because that's going to lead to wound infections. And you don't want to massage their skin vigorously because, again, that can cause bruises or it can cause damage. So you don't want to do that. Question 15. What is the significance of proper footwear for diabetic patients? Hey, Ross, thank you so much. All right, so we have A, prevents foot injuries and complications. B, enhances fashion sense. C, increases discomfort. Or D, supports higher risk of infections. Why do they need to wear the right shoes? Yes, it is A. So when you see them wearing the shoes that are tight on their feet, pointy toe shoes, just because they're fashionable, or I'm in Florida, they can't wear flip flops either because we need to protect their feet at all times. So, proper footwear helps prevent injuries, ulcers, and complications in diabetic patients, thus reducing the risk of infections. So, their feet should be covered, no open toed shoes for them. Number 16. What is the recommended site for performing a finger stick to obtain a blood sample for glucose monitoring? A, the tip of the finger, B, the side of the finger, C, the palm of the hand, D, the back of the hand. And I know you all see us going for the tip of the finger, but we're not supposed to do that. So it is not A. It's actually B, the side of the finger. And the rationale is that the side of the finger is the recommended site because it contains fewer nerve endings compared to the fingertip, resulting in less discomfort for the patient. Additionally, the side of the finger provides an adequate blood supply for obtaining a sufficient sample of testing. So this is what I want you to do. And don't tell your employer that I said that I want you to do this. I want you to check your own blood glucose level, and I want you to stick yourself right in the center of your fingertip. Ouch. It's going to hurt. It's more painful if you do it there. So go to the sides of the finger, and you can still get a good drop of blood if you do so. I know, Anna. All right, so 17, which statement is true regarding moisturizing the feet of diabetic patients? So we already know we're not going to put lotion between the toes, but they still need moisture. And why is it? Is it A, you want to avoid moisturizing to prevent slipperiness? B, moisturize only when the skin is excessively dry? C, moisturize regularly, avoiding between the toes? Or D, use any lotion without checking for sensitivity? Yep, can't trick you on this one. It is C. So you don't want your diabetic skin getting excessively dry. We want to prevent that. We have good techs. You see the skin's dry, you're going to put some lotion on the feet. So regular moisturization helps prevent dry skin, but it should be done carefully to avoid moisture accumulation between the toes. So you all have that one. Number 18. Let's see if you can get this one. What should nursing assistants do prior to performing a finger stick for blood glucose monitoring? A. Apply alcohol wipes to the finger to clean the site. B. Warm the finger by rubbing it vigorously. Read all of them. C. Wash hands with soap and water. Or D. Apply a tourniquet proximal to the finger. What should you do before you stick someone's finger? And this is the main reason why my CNAs fail their tests. Because you all do not like to wash your freaking hands. You all, it is C. You got to wash your hands. Yes. So for this one, everybody, it is not A. You just don't start off by applying alcohol wipes. You want to wash your hands first. So rationale, prior to performing a finger stick for blood glucose monitoring, nursing assistants should wash their hands with soap and water to ensure cleanliness and reduce the risk of contamination. So if you're taking your exam in Florida, remember you're supposed to wash your hands before and after care. But in the real world, entering a patient's room, you're also supposed to wash your hands before and after care. You just don't want to walk in there and start doing the care, cleaning their finger with alcohol because you're contaminated. We have to get the contaminants off of you also. All right, number 19. Which of the following statement best explains why podiatrists are preferred over nursing assistants for toenail care in diabetic patients? A, podiatrists or foot doctors have advanced knowledge of foot anatomy and pathology. B, nursing assistants charge lower fees for their services. C, podiatrists are less accessible than nursing assistants. Or D, nursing assistants are trained in sterile technique for foot care. Yes, you all got this one correct. We need patients who have diabetes to go to a podiatrist, not to their CNA, because of A. The podiatrist knows more than a CNA. They are equipped to assess and manage foot conditions, including toenail care, while considering factors such as neuropathy or the tingling, vascular disease, the health poor circulation, and foot deformities. So that is above your pay grade. They don't pay you enough anyway to be around here trying to clip and take care of a diabetic person's toenails and feet. You can do basic care, but anything advanced, refer that to the nurse so she can refer it to the podiatrist. All right, number 20, everybody. What complication can arise if the water temperature is too hot during foot care for diabetic patients? A, increased risk of fungal infections. B, exacerbation of diabetic neuropathy or the tinglingness. C, formation of calluses and corns. Or D, burns and tissue damage. If the water is too hot, what's going to happen to your patient? Gregory, Tamika, Lunine. Yes, everybody, it is D. If it's too hot, you're going to cause a burn and tissue damage. And the rationale is as follows. If the water temperature is too hot during foot care for diabetic patients, burns and tissue damage can occur, particularly in patients with decreased sensation in their feet. Diabetic patients may not perceive the heat and may not react quickly enough to prevent injury, increasing the risk of burns and tissue damage, which is why you want to allow diabetic patients to not only check the temperature levels with their feet, but usually with their hands first. So it's okay. Would you test it with your hands? And now if the water temperature is okay, you can have them tested again with their feet. But you all, I only did 20 questions tonight because I have a big event tomorrow, but I'm going to be back on here on Thursday. And on Thursday, we're going to be reviewing post-op patient care. What does a CNA need to monitor whenever they're taking care of somebody who's fresh from a procedure or fresh from surgery? And so as always, I pray for you. I thank you for watching, and I wish you much success on your future CNA exams. It's 9:54 here. Nurse Eunice is going to bed. Good night, everybody.